In the pulsating world of healthcare, effective communication is the heart that keeps everything alive and ticking. One model that has proven instrumental in fostering this crucial element is the 4 Habits model of healthcare communication. This model, rooted in a set of 4 simple but impactful habits, serves as a guide for healthcare providers to improve their interactions with patients. Now, imagine a healthcare provider taking a few moments at the beginning of a patient's visit to build rapport. They ask about the patient's day, their journey to the clinic, perhaps even a light comment about the weather. This is the first habit: invest in the beginning. This simple act sets the tone for a positive and productive conversation. It transforms the sterile clinical environment into a more personal and welcoming space, paving the way for open and honest communication. Next, let's step into a situation where the healthcare provider encourages the patient to share their perspective. They ask open-ended questions, they listen attentively, they engage in active dialogue. This is the second habit: elicit the patient's perspective. By doing so, the healthcare provider gains a deeper understanding of the patient's concerns, fears, and needs. This, in turn, allows for a more informed and personalized approach to their care. Now, picture a scenario where a patient expresses concern about a procedure. The healthcare provider, instead of dismissing their fears, acknowledges and validates their feelings. They express understanding and assure the patient they're not alone in their journey. This is the third habit: demonstrate empathy. By doing so, the healthcare provider builds trust, strengthens the patient-provider relationship, and ultimately improves patient satisfaction. Lastly, imagine the healthcare provider summarizing the key points of the conversation, providing clear instructions for the next steps, and asking if the patient has any questions. This is the final habit: invest in the end. This habit ensures the patient leaves the interaction with a clear understanding of their care plan, fostering compliance and better health outcomes. These 4 habits: investing in the beginning, eliciting the patient's perspective, demonstrating empathy, and investing in the end, form the bedrock of the 4 Habits model. By incorporating these habits into their practice, healthcare professionals can significantly improve their communication with patients, leading to better patient outcomes, greater patient satisfaction, and ultimately a more rewarding experience for both parties. Remember, in healthcare, communication is not just about conveying information. It's about building relationships. And with the 4 Habits model, healthcare providers have a powerful tool to do just that. So, keep these habits in mind, practice them, and watch as they transform your interactions with your patients.